people will come in and ask me what causes the wrinkles around their mouth. And so I'm going to try to answer that question for you today and talk to you in some detail about what are some of the causes, and then also maybe what are some of the things that we can do to offer solutions or minimize the appearance of those wrinkles around the mouth. My name is Dr. Lynn Neiman. I am a board-certified anesthesiologist, and I am also an aesthetic medical provider. I own and operate the practice of Blossom Medical in Northern Virginia, and I am super excited that you're taking a couple minutes out of your day to watch this video, and hopefully I can answer some questions for you, just give you some good background information and education, and then also give you maybe some solutions or ideas so that you know how you can treat those pesky little lines that form around our mouth as we go through our years. Some people will call them or refer to them as smoker's lines, or just they notice that they're having their lipstick not stay on their lines as much, but some little lines that form around the upper lip as lines around the mouth. Those are the ones we're going to focus on in this video. There are lines that can happen kind of by the side, lines that can happen a little bit lower beneath the lip, but I'm going to really focus on these lines that happen on the top lip today, talk about why those occur, and then also maybe some of the things that we can do. So there are 4 main reasons that we have lines that form on that upper lip over time. And if you've listened to any of my videos in the past, you've heard me talk about these same principles, and this applies to the top lip as well. We have changes that go on over time that happen all over the face, and those changes also happen to that upper lip. Those changes are differences in bone, differences in muscle, differences in subcutaneous fat, and then also differences in our skin. So those are the 4 things. So bone, muscle, subcutaneous fat, and skin. And the changes that are happening there really cause us to see those vertical lines. So let's talk about it a little bit. So what do I mean by bony changes? Typically, as we age, we will have some bony loss in our face. So we have projection in our cheek that kind of projects forward and out. As we age, that kind of tends to recess back just a little bit. The same thing happens around our opening for our nose. We refer to that, there's kind of like a little triangle we refer to as a piriform aperture. That tends to get a little bit wider as we age, and the bone around that tends to thin out a little bit. So we have less support around the corners of our nose. We tend to start to see that nasolabial fold kind of deepen just a little bit over time. This is one of the reasons for that to happen. And then we also have a little bit less support from the bone that's above our lip. Our teeth change size and projection just a little bit because of their association with the bone and then just life. And so we have less bony support. And also, for some people who have maybe had some dental loss or dental work done over time, that may change the bony support that's going underneath that top lip. So think of it like that is your foundation for your house. If you've got some shifting that goes on in the foundation of your house, it's going to affect everything else that's over top of it. So the same thing there, the same principle is assigned there, that if we get some changes in the bony support underneath, that's going to change what we see on top. So that's just one thing to be aware of. Another thing to be aware of is that we have changes in the subcutaneous and deep fat pad layers of our face everywhere as we go through life. Typically, those fat pad layers become thinner over time and we lose some volume. And the same thing happens in the top lip. Those fat pads that we have right underneath the skin and underneath the muscle tend to get a little bit thinner over time. And so when that happens, we lose a little bit of just that fluff to that area. And so we start to see the muscle movement a little bit more. Just for you to visualize, I feel like I can see this really clearly in my head, but if you don't know what I'm talking about, this may help. I want you to visualize a layer cake for me. So let's start with the icing. So if the icing is on the top, like your skin, so that's our top layer. The next layer, right underneath the icing, we have a little bit of a fat pad layer. So that's our layer cake. A little bit of a fat pad layer. That's our subcutaneous fat. Beneath that, we have something called the SMAS. That is our subcutaneous muscular aponeurotic system. That contains our muscles, vessels, nerves most of the time, and that is where we see that muscle movement and muscle pull from. Underneath that, we have another layer. So we've had skin on the top as our icing, subcutaneous fat is our first layer, our mass is our middle layer, and then the bottom layer to that is another layer of fat that we have. Everyone has that in their face, and then we'll have kind of bony support underneath that. So that's our layer cake. There's our cake stand, our bone, and then we have our layers going on top of that. So hopefully that helps you visualize what I'm talking about here. But that superficial and that deep fat pad layer tend to get a little bit thinner. And then we have our muscle layer. Our muscle layer connects to our skin and pulls on it as our muscle contracts. And so over time, if we have less padding between the muscle layer and the skin, and we've got that muscle layer pulling over time, we're going to start to see where that muscle is pulling. And we appreciate that when we look in the mirror by seeing those vertical lines above our lip. Now, the more we move that muscle layer, so yes, smoking, but not only smoking, drinking from a straw, eating, talking, laughing, doing life, then when we're moving our mouth around, we are reinforcing those muscle movements, and so we are reinforcing those lines on the surface of the skin. And we appreciate those surface lines on the skin. And then also, and lastly, important to know is that as time goes on, we have changes in the quality of our skin. Typically, that is in the reduction of collagen that we have in our surface of our skin, making it just a little less resilient. And so we can see just not as robust skin on the surface, and then that leads us to appreciate those lines a little bit more. Some people will undergo a process of something called glycation, which actually makes that skin look a little extra bumpy or a little extra rough on the surface of their lip. And when we see that there are additional steps or additional treatments that we can do to help reduce the appearance of those fine lines. So if you're starting to see some of those fine lines, what are the things that you can do to treat that? And so if there are 4 things that are causing those fine lines to form above your lip, that means that there's more than one answer in terms of your treatment. So simple things being simple. Let's ask that muscle to not pull so hard on the skin. So the place I start with a lot of my patients is using a little bit of Botox in that upper lip to help to treat that muscle called the orbicularis oris that goes around the mouth, to ask that muscle to just not pull so hard on the skin so we don't see those vertical lines quite as much. That is a great place to start. Patients can try that out to see how effective it is, but we also know that Botox treatment in that top lip is going to last about 6 to 8 weeks. If for some reason a patient does not like the feeling of that Botox, it will wear off and it's not a permanent change. So that's a great place to just start with a treatment plan to see how effective it can be, and then to also see if that is giving a patient enough result or if there's something that they want to do more. So if we want to do more, here are the things that I would recommend. I would recommend considering a little filler. Again, judicious use of our hyaluronic acid fillers in areas that can help provide support. So help really make that cake stand or our bony foundation a little bit more supported so that we have better support for the tissue of the upper lip is a good strategy. Sometimes a little bit of a really thin filler can be used either underneath, so in that top layer of our cake, that subcutaneous layer of fat, we can use a little dermal filler in that area to help hold up some of those lines and support them from underneath. And sometimes we can use teeny tiny micro droplets of filler placed directly in those vertical lines to help reduce their appearance. Think of that as airbrushing. So it's going to reduce the appearance of those fine lines, but it's not going to make it go completely away. So as a patient, your expectation has to be improvement, but maybe not necessarily making those lines go completely away. So we've talked about Botox, we've talked about filler, and then other things that can help make a change as well is that we can use something called a CO2 laser, or we can use fractional resurfacing. Our CO2 laser and our laser that we have here called the Ultra, also Moxie would be really good, but CO2 especially can really help to improve the overall quality of the skin around that perioral area, around that lip area. And that's really now treating that skin, asking for collagen induction, really doing some refinement in the surface of the skin, and can really make a big impact in that area. So because our origin of our lines around our mouth is multifactorial, sometimes our treatment also should be multi-pronged. And what I mean by that is if you just rely on one treatment alone, whether it's only Botox or only filler, which I don't recommend because you can end up kind of looking like you have a thick or almost like a mustache on that top lip by overusing filler in that area. By using multiple tools in the toolbox, you can get a really, really beautiful result. And those tools, again, might be using a little bit of Botox, using a little bit of filler to treat the lines of the upper lip, and then also considering a laser treatment, whether that is a fractional ablative or fractional non-ablative laser resurfacing, using a CO2 laser, using something like Ultra Moxie, are all things that would help to improve the quality of the skin of the upper lip. So those are some ideas for you. And then people often ask me about prevention. What can I do? There are a number of products that are available out there in terms of straws that have maybe a wider mouth opening around them so that you don't have to purse quite so much when you drink. I don't know that there are actually good clinical studies that support the use of those scientifically, but I can say if it makes you feel better, then that's one thing you shouldn't stop yourself from doing if that's a feel-good product for you. Otherwise, I say life is going to happen. Enjoy your life, smile, kiss, pucker, laugh, do all the things, and just know that we have some solutions for you if that's an area of concern for you. But one thing I can say is that it's 2024. If you are a smoker, let's have a conversation and let's get you help, because the one thing that you can do for your health that is more impactful than anything else that I talked about in this video is quitting or decreasing the amount that you're smoking. That can just dramatically change your life. And so if there's one thing I can say about those lines above your lip, if you are a smoker, is let's talk about reducing your smoking or stopping altogether. But I will say that even if you are not a smoker, you can get those lines. People call them smoking lines and they come in and say, but I've never smoked a day in my life. Why do I have these? You have them because you are living, and you have them because you have spent your life doing happy things like smiling and laughing and eating and sharing meals with people. And those are just part of life. We can help you with them if they bother you, but absolutely continue enjoying your life. And I hope that this video was helpful for you, gave you some strategies. And remember, I am a physician, but I am not your physician. These are my strategies I employ in my clinic, but obviously have a discussion with your provider and see which of those procedures might be of benefit for you. If you happen to be in the Northern Virginia area, you can come and see us at Blossom Medical. I would love to talk about any of these things with you and maybe come up with a way to help you achieve a look on the outside that matches how you look and feel on the inside. We also offer, for those of you who are not in the Northern Virginia area, online skincare consultations, and there are some amazing things that we can do with skincare alone that will boost firmness and will boost collagen production for you by using our Zeo Skin Health. So we can optimize your skincare and help improve the quality and appearance of your skin, even without some of the treatments that we talked about today. So if you are interested in a virtual skincare consultation, you can either book through our website or you can check out the comments below, and some of that information on making a skincare consultation will be available to you. If you find this video helpful, I would surely love it if you would like and follow for more content in the future. And if you think you have a friend who might be interested in some of this information, I would love it if you would share this with them. I hope you have a really beautiful day and enjoy talking about all things aesthetics, and I hope that you learned something and can take some useful information with you. Have a great day.